So yeah, let's start. So firstly, we're going to discuss what alternative medicine actually is. So alternative medicine, so complementary and alternative medicines, which are also known as CAMs, are treatments which fall outside of mainstream healthcare. And they can be used in conjunction with conventional medicine. So that's more complementary medicines, or they can be used as a substitute. And these are just some examples of CAMs, which you might know a bit about. So the first one is acupuncture, which is a traditional Chinese treatment where they insert needles at certain sites in the body. And although I think originally this was meant to sort of drive the chi or life force, I believe, that was the idea behind it. But now they've realized there is actually a more scientific basis behind it. So the stimulation of the sensory nerves in the muscles results in the body producing endorphins, which relieve pain. So modern acupuncture is actually sometimes performed in GP practices to relieve certain joint pains, chronic pains, and headaches and stuff like that as well. Although it's generally thought of as a complementary treatment. And aromatherapy is a little bit more controversial. It involves use of essential oils, including citrus oils, rosemary, eucalyptus as well, and they usually involve smelling these substances, inhaling them, or applying them as a cream to the skin. And usually these don't really have a scientific basis or a very weak scientific basis behind them, and they're used as complements really, and doctors wouldn't ever prescribe aromatherapy as a treatment for people. And hypnotherapy as well. It involves hypnotizing patients to relieve anxiety and stress. And it has shown to be somewhat effective, but it's quite controversial. But other techniques like meditation, which is a bit more understood, the reasoning behind it, and there is scientific evidence behind it, although they're not really used as medical treatments in conventional medicine. So yeah, those are just some examples.
Okay, so we're going to be talking about why is the use of these CAMs limited. So in the UK, most CAM treatments are actually private and generally not reimbursed within the NHS. And this means that they are not subject to the same regulations as conventional treatments. So which ethical issues might the restriction of CAMs lead to? Before we reveal this, does anyone have any ideas, first of all? So just to remind you, Shabas, what are CAMs?
CAMs are complementary or alternative medicines. So yeah, as the slide says, they're not really provided in the NHS. So we want you to think about what kind of ethical issues restricting CAMs might lead to. So if anyone has any ideas, please do put them in the chat.
Yeah, so someone said justice. That's quite interesting. Would you care to explain why? Just a bit more, just explore why you say justice, exactly why that relates. I mean, obviously justice relates for quite a few reasons, because obviously, justice means treating all patients equally, and obviously if some patients need this or might benefit from this, and if it's restricted, then that violates the justice pillar. But I think we'll move on. But that's a really good point. Justice is a really good idea.
Yeah, so in regards to justice, that is a point you could mention. Sinan, I don't know if you want to go through these ones. Yeah.
Okay, so since CAMs are generally privately provided, sorry, someone said in the chat, autonomy, patients should be able to choose if they want to access to CAMs. Yeah, again, and another excellent point that obviously that relates to autonomy and also the availability of medicine for a patient, because obviously it's not, the CAMs do exist and they are something that can be accessed quite easily by the medical field if they need to. So if patients choose to have it, then they should be able to do it. Although you have to remember that doctors are allowed to veto this. And obviously, if they're allowed to say, maybe that's not the best idea because it might actually harm their health, and people might be, I'm not saying this will happen, but it's quite possible for people to, rather than using CAMs for productive purposes, sort of develop a dependency on them. But yeah, good point. Autonomy is a very good point. Cool. So since CAMs are generally privately provided, wealthier consumers may have a higher percentage chance of actually getting them, and this might be legally or illegally, but it's true. Providers of CAMs are often not medical professionals and may rely on traditional philosophies and principles rather than scientific ones. They also do not necessarily have to adhere to rules such as patient confidentiality. CAMs generally do not go under the same rigorous clinical trials as conventional medicines. Obviously, this is quite a big one as well, because lots of people, CEMs, especially things like, controversial ones, especially such as drugs like cannabis or other drugs which can be used recreationally, are sometimes not put through the same rigorous clinical trials, and obviously in sometimes have substitutes put in which may not be as healthy, and there's a lack of funding for CAM research, and this is quite obvious because these are not something that the NHS is pushing or emphasizing. So yeah, I mean, there's a wealth of points, and well done for everyone who volunteered an answer, and yeah, you guys are right.
Right, so I think we'll move on now and we'll just kind of apply this knowledge to a case study. So I'll just read this out. One of your patients, Connie, aged 53, has recently been admitted to the oncology unit after a malignant tumour was detected in the right atrium of her heart. So you tell her that successive cycles of chemotherapy will give her the best chance of survival. And if the tumour is not treated in the next few weeks, there's a possibility of permanent heart damage and death. However, her husband Charlie tells you that he recently read about a eucalyptus-based essential oil, which according to him is highly effective at targeting tumours. He wants Connie to take this instead. And Charlie also tells you that his brother Cal died aged 20 after undergoing chemotherapy and radiotherapy to treat lung cancer, and therefore he's very skeptical about the effectiveness of chemotherapy. And Connie and Charlie have 3 children as well, all of whom advise their mother to go ahead with the chemotherapy. But Connie tells you that she's unsure which course of action to take. So we just want you to think now what you would do as a doctor in this situation and whether your decision would follow the 4 pillars of medical ethics. So would you persuade her to go ahead with the treatment, or perhaps even tell her, strongly advise her not to, or maybe force her? Is that something you'd do? Or would you allow her to go ahead with the essential oils treatment and allow her to leave the hospital? So yeah, if you just put your answers in the chat, and then we'll discuss that bit. Okay, so someone said, research the alternative therapy and then give her a balanced argument for both, giving both pros and cons for each, give her all of the information she needs to come to a decision. Right, I think that's a very good answer, because that is, as a doctor, it's your responsibility to make your patients aware of all possible courses of treatment. And if this is a genuine possibility, then it's important that she's aware of it and knows about the risks and the benefits, and whether it's more likely to succeed than the chemotherapy. Although from this case study, we kind of know that that's probably not the case. So yeah, and then someone saying, is having both not an option? Right, so from this example, I'd assume not, as in she would need to go to chemotherapy now, basically. And I assume that, yeah, so going ahead with the essential oils, she wouldn't go ahead with the chemotherapy either. But yeah, if you're using it as a complementary treatment, then perhaps you could suggest her having both might be an option. But does anyone think it would be your duty to persuade her to go ahead with the chemotherapy? Because as a doctor, you would kind of use your expert knowledge. You would know that this is the best course of treatment for her, and therefore you would think that this is what she should do. So do you think you should persuade her?
No, because you can't force them, but like...
Sorry, you're cutting out. We can't really hear you.
Yeah, if someone was someone speaking out loud, I couldn't quite hear. Okay, maybe not. Okay, someone said, I think you could encourage her, but you can't force her. Okay. And then someone else said,
sorry,
yeah.
Shiv, that's just one thing. I think force, I don't know about force, but coerce is the better word here, because obviously autonomy is that patients get to make their own decisions, but that doesn't mean you can't advise them. That's the whole point of a doctor, is that you use your medical knowledge to advise them on the best course of action. So the whole point that you can encourage her, or I don't even know if you could encourage her, I think you should just lay out the facts and tell them what you think is best in a completely objective manner, which obviously you may not agree with what they're thinking, but that's the whole point of a doctor, is to, or not the point, but the medical ethics, the good medical ethics as laid out by the GMC, say that you can't coerce them. So I think that's a really good point, that, you know, you should tell her the facts, tell her what you think is best, but that's within your professional capacity, nothing beyond that. And again, this is like reinforced by what George says, if you want to talk about that.
Yeah. So someone said, yeah, so you said only advise her to do with the ethical pillar of beneficence. Okay, yeah. So many people have said you shouldn't persuade her, but you should kind of coerce her and kind of emphasize the fact that it will be more beneficial for her, and say that would, you know, have the best outcome for your patient. So that does link to beneficence, right? And someone said if they didn't have capacity, right? So I think you'd assume that they would have the capacity to make a decision in this case, although you don't know that for sure. I think it just says she's unsure, so she doesn't know. You know, she's just not aware of what would be best for her. But I think as a doctor, you'd want to tell her, you'd want to show her that this is the best course of treatment. But at the end of the day, as many people have said, it is up to her what course of treatment she undergoes. And that kind of links to autonomy. So I'll just put up on the screen now some of the points. So if you encourage her, not force her to undergo chemotherapy, then it would give her the best chance of surviving, which is your role as a doctor, which links to beneficence. And chemotherapy has been proven as a treatment for cancer, as being an effective treatment, whereas the essential oil may not be tested. But as someone has said at the beginning, it would be perhaps your role as well to go and research that, and just, you know, perhaps find some information that shows that it's perhaps not that effective, and then bring that information to her attention. But another point you might want to consider is her children, and the fact that they, you know, want her to go ahead with it. Although that's kind of a weaker point, considering it is her decision at the end of the day. But you could also allow her to leave, which would, you know, it would support her autonomy, considering she hasn't given consent. So you cannot really force her to go ahead with it. But chemotherapy can have some side effects as well and be emotionally distressing, whereas taking essential oil might not. But again, I think that's quite a weak point. So yeah, I think we had a good discussion surrounding that. We're going to move on now, and we're going to continue with the same case study. But yeah, Sidan, I don't know if you want to delete this one. Yeah.
Okay, so this is continuing. So Connie decides to leave the hospital and take the eucalyptus-based essential oil every day. Remember, we talked about this earlier. 1 month later, she comes back to the hospital and tells you that she's in agony. She is coughing up blood and is finding it very difficult to breathe. An X-ray confirms that the tumor has spread to her lungs and requires an immediate operation if there is to be any chance of her survival. Connie falls unconscious as she is taken to the operating room, but she has not expressed whether or not she wants to go ahead with the procedure. Her husband, Charlie, assures you that she did not want to go ahead with it. You decide to go ahead with the procedure, as otherwise Connie has no chance of survival. Unfortunately, despite your best efforts, you were not able to save Connie, and she died during the operation. So who is responsible for Connie's death here? So think about the medical principles, obviously, to answer your question. And should patients be allowed to use alternative medicines if it goes against the judgment of their doctor? Now, obviously, the current law is that, you know, patients are allowed to take anything they want. They take the doctor's advice. They don't have to. They should really listen to their doctor, but they don't have to. And you know, it's very much up to the patient. However, this is more of a hypothetical discussion, as you know, in BMAT and everything, you will have to have and you will have to write an essay, especially in the BMAT, where you discuss a topic based on your opinions and some facts to back it up. So if anyone has any ideas, please put them in the chat or let us know. Feel free to unmute yourself and talk as well. Who do you think was responsible for Connie's death? Let's answer that one first. So if you guys believe that the husband was responsible, can you type H into the chat? If you believe Connie herself was responsible, write C. And if you believe the doctor, then it's D. If anyone else, then please write O. O for other. Right, so currently we're getting we've got quite a few C's. Someone's got O, someone said D. Okay, right. We'll have one for each one. So, sorry, Harry, could you please explain why you said H and C, specifically why you said the husband? If you don't feel like speaking out, you can also put it in the chat. That's fine.
And someone else has put, oh, I wonder if you want to suggest who you think is responsible.
Okay, so Harry said that I said the husband because he's the person who convinced Connie against the doctor's wishes. Yeah, so that's a really good point, because obviously the doctor is meant to, doctors go under, and all medical professionals actually go under rigorous training for many years to have the amount of knowledge that they have on a specific topic. And so it just makes sense to listen to what they're saying, because they are saying it for the best of your interest, the patient interest, because that's one of the medical principles. So yeah, that's a really good argument to be made, that because the husband convinced her to do it. So that's a great point. Would anyone, so the person who said, oh, other, would you like to explain why you said that? Again, you can unmute yourself. Who had actually made the decision. But ultimately it was Connie who had actually made the decision, and a condition worsening to such a point. Yeah, okay, yeah, it is also Connie's fault. So someone said, ultimately Connie had competency, is able to make decisions based on information presented to her. Yes, so that's good, as in why explaining her. So I would say no one takes direct responsibility. The blame is not the main concern here, but that everyone had a share of responsibility. Okay, just to play devil's advocate here, why do you think the doctor had responsibility, or any responsibility? George, the doctor, as they have not informed the whole family, the consequence. So if H had been informed, then Connie may have still lived. Okay, I forget. Did the doctor say what why he may not have been, why he would not recommend the eucalyptus-based essential oil?
No, I don't think that was in the example. I think
Right.
it just said that she decided not to go ahead with it and leave.
Right. Okay, so yeah, so then that's a really good point, because if the doctor didn't inform, so obviously the doctors are meant to give their opinions, but it's also possible that the patient, I believe her name is Connie, she didn't ask the doctor's opinion on the eucalyptus oil, eucalyptus-based oil. So if she didn't bring it up, then technically it's not entirely the doctor's fault. Although you could argue that the procedure was carried out by the doctor, so maybe that may have been his fault. But there is a wide array of variables there. Someone said that are doctors allowed to check up on their patients without the patients coming to them first? What do you mean by check up on their patients? And it's a doctor's responsibility to present all information to the patient, including the risk and benefits. Yes, it is. And so, objectively, they should be doing this. But again, if a patient doesn't tell them that, I'm considering an alternative to your treatment, in the form of a eucalyptus-based essential oil, then the doctor can't exactly preempt that. And he can't exactly just say, what the risks and benefits are of that. So again, I believe that the person who said other, where everyone has some sort of blame, is true. Although, you can also argue that some people had more blame than the others. For example, everyone's justified in their claims. I believe Connie was at fault for not disclosing the fact that she was she wanted to take essential oils. Maybe the husband was at fault because he convinced her. Then the doctor maybe didn't, maybe the procedure went wrong, or some other fault in taking the history that she wasn't able to disclose the fact that she was considering eucalyptus oils. So it's quite important. And someone said the medical team, not only the doctor, was the last person to take an attempt to save Connie's life. And I'd say that an ethical doctor would never attempt to voluntarily take unnecessary risks that might put Connie's life in danger. Although, would you say that he did put Connie's life in danger? Because he suggested a procedure, and it says here, he went ahead with the procedure as otherwise Connie had no chance of survival. So I don't know if that's an unnecessary risk. if you can justify why it may be, then that's also a valid point. As in, after Connie left, if they maybe had called her in for a checkup, could they have prevented her death? That's quite true, because that's a good point, because if they had, by some stroke of luck, called her back in and realized something's going wrong that Connie may have not realized herself on a surface level, then maybe they could have stopped it and prevented it. And, then that would be the ultimate time to ask, did you take any supplements or any CAMs or some sort of alternative medicine which may not have been good for you? And at that point, the eucalyptus-based essential oil would be disclosed. But again, I think it just comes down to coincidence, because if and I'm not sure on this, but because I don't know, but again, I think that has a aspect of luck, because if she was fine when she presented, then I don't know if the doctor would have felt it necessary to call her in later on. So I guess that's, again, something that no one can preempt. Obviously, no one can predict the future. But yeah, if that had happened, then that would have been, that could have potentially prevented her death. In my opinion, it is very unreasonable blaming the doctor when they are not mind readers. And may not know that they want to take alternative medicine. Can they check up on the patient by themselves? But even then, this is going further and beyond for a doctor to do, as they should not be required to do. Yeah, again, so that's a really, really diplomatic point, and it works really well. I don't know if you guys have heard, but there were a few case studies with diet pills, where these diet pills were ridiculously harmful for the patient's body. They were, so some diet pills included eggs of worms, I think. So people were ingesting the eggs, so the tapeworm would grow inside their body and eat at some of the stuff to make them lose weight, which is a ridiculously unhealthy thing to do. And as well as, all these there were quite a few case studies of diet pills which were unnecessarily risky and not medically proven at all, and then people took them because they thought that they would work. And these are all the same type of alternative therapies which don't which have risks which aren't medically they're not tested or anything. So like all of this is quite a grey area, especially with things that maybe the NHS doesn't provide or doesn't endorse. So this is a clash of autonomy and beneficence, as Connie did not have capacity to consent to the procedure. But again, the doctor did not communicate the harm of the procedure to the family. She's not wanting to go ahead with it, right? And so in the end, Connie passed away. Therefore, you can say it was the doctor's mistake. See, that's a really good point, because obviously autonomy would have been that Connie would have given the consent, but then we don't know if Charlie, her husband, had the power of attorney to do that, because obviously in consent, power of attorney is a big thing. If Connie, sorry, how old is Connie Chavez?
It was 56. Can't
56, right? Okay, so
53. Sorry.
Yeah, so she would have been able to give consent. And so if Connie would have, if she had signed for power of attorney, if her husband was power of attorney, had power of attorney over Connie, then he could have made that decision. But we don't know that here. So technically, if Charlie saying, if he doesn't have power of attorney, Charlie saying yes or no to the procedure doesn't really matter, because he doesn't have, what we're working under the assumption that he doesn't have power of attorney. And so his consent wouldn't matter. And I do believe that in our consent session we covered, there are certain cases where if doctors think that there's a procedure that patients are saying no to, but without, they would definitely die, they are allowed to hold them back and do the procedure anyway. But that's in very rare circumstances. And, in this case, it specifically says you decide to go ahead with the procedure, as otherwise Connie has no chance of survival. So in that case, it probably is one of those procedures where you need to go ahead with it. So I don't know if that's the reason why it's doctor's mistake, but maybe the sentence where the procedure, but again, the doctor did not communicate the harm of the procedure of the family, is a good one, because it's quite possible there may have been some other risk that the family might have objected to, which may have been more reasonable. But again, we don't know, because the husband said no to the surgery and he did not have power of attorney. It doesn't say the procedure killed her, though. That's a very good point. So
I don't think we can interpret this as saying the procedure was responsible for her death, but it's just, she died despite the procedure. And also, considering that she was in a critical condition, I don't think the doctor had any choice but to go ahead with it. There wasn't really time to inform the family of the risks and benefits, and she was unconscious as well. But I think regarding this information, if we move on to the second sort of question here, many people in the chat did say that they thought Connie herself or the doctor was responsible for the death, considering that the doctor wasn't aware that she'd taken these, and perhaps that the doctor should have encouraged her to go ahead with the chemotherapy instead. But considering that, do you think patients should be allowed to use alternative medicines if it goes against the judgment of their doctor, or do you think they should perhaps be, could this situation have been avoided if Connie was forced to go ahead with the chemotherapy, and therefore the doctor knew exactly what she was doing. She didn't take any alternative medicine, and therefore there was no need to, perform any procedure on her. Or do you think, it should be up to the patient and we should respect their autonomy, even if it means putting their life at risk? So
someone in the chat said that they should be allowed to take TAMs.
Yeah.
Do you want to explain why you think that?
Well, I think the main argument for that would be to do with autonomy, really, because it's up to a patient what treatment they receive. But yeah, I don't know if anyone else has any other suggestions.
Sorry.
Yeah.
You sort of went into the whole should patients be allowed. I think it would open up a wide field of because then we would have to make we could make vaccinations. If you didn't have a vaccination, that's illegal. But again, that goes against autonomy. Even if it's harming people, you can't prevent people from making decisions that are about themselves, essentially.
Yeah, I absolutely, I agree, yeah. And I think that's kind of the main argument here regarding autonomy. So, or perhaps a solution to this then, if a doctor cannot force a patient to go ahead with a procedure or certain treatment, then perhaps they should be aware, they should be made more aware of what the patient is doing and what they're taking themselves. And so people suggested in the chat that the doctor should have known about what the patient was taking, and should have been kept up to date with that. So maybe that could be a solution, trying to make sure that they are aware of what the patient's doing and really inform them if they get to a critical stage, perhaps. But someone said I wouldn't advise them to unless they seemed very well informed about the risks and benefits of it. But of course, I wouldn't force them to do anything. Right. So yeah. So I think we're considering in this situation that the doctor would have told them the risks and benefits, but they it is up to them in the end. And yeah, so that's an interesting point. It's kind of the clash of beneficence and autonomy here. But I think we can move on now, so we're going to talk a little bit about placebos and alternative medicines. This is just kind of a point to think about, really. We have discussed placebos in the past, so I'm sure they're imitations of a drug which can be given to a patient during a blind or double-blind trial, and they're usually used to monitor the effectiveness of a drug. But they can also be used to observe the placebo effect, which is where you kind of get better due to sort of thinking you're going to get better. It's very interesting, but so you could argue that placebos don't actively treat a patient's condition, but they may bring about a positive change anyway. But alternative medicines also may sort of bring about this change as well. They might, then even though if they're not directly proven to treat a medical condition, they can still sort of positively impact the patient due to the placebo effect, due to them thinking that the treatment's going to work. So the question now is, should doctors be allowed to prescribe alternative medicines in the place of conventional medicines? Should they, because right now doctors aren't really allowed to prescribe these as conventional medical treatments. But do you think they should be? We won't spend too long on this, but if anyone has any ideas or any thoughts, then please do put them in the chat. Okay, right, so someone said for yes, because beneficence for the benefit of the patient, but on the other hand, it counts as lying, could harm patient-doctor relationship. Right, so I think you mean it in the sense that if you prescribed alternative medicines without telling a patient, similarly to a placebo, yeah, and it could harm a doctor-patient relationship. It breaks sort of consent, and which is a big part of medicine. But at the same time, it could, help that, not necessarily just that patient, but it could, improve, medical treatment generally. Someone said, if you believe that this will bring the best possible benefits to the patient in this situation, I believe it's ethical. Okay, so you suggest that perhaps it is ethical to prescribe alternative medicines, even if they're not perhaps rigorously tested, or the benefits of them aren't proven. If you think that it's a possible avenue that could help them feel better, then perhaps it might be worth it.
Right. I just wanted to say, when prescribing medicine, it is highly illegal to prescribe anything without letting the patient know what it is, or to conduct your sort of own experiment that, I just want to see how well an alternative medicine would work without telling the patient. And, I'm pretty sure there's lots of medicines which you can't prescribe anyway through the NHS because, it's against policy. So it's highly illegal to conduct any experiments which could harm the patient, or maybe just illegal. There are rules against it. So be careful of that.
Okay, so there's just a couple of points that people have made. Someone said, I'm sorry to break the conversation, but could you go over why the NHS has yet to legalize placebos as a medication? So placebos are legal in the sense that they are used in drug trials, but they cannot be a doctor cannot just say, okay, I'm going to prescribe you a medication, but it turns out to be a placebo, because, especially when it's quite a serious condition. But if a person signs up to a trial, then they will be aware that, as someone else has said, they're aware that there's a possibility of them being given a placebo. So therefore, the patient is aware of that risk. But someone else has said it isn't the same as alternative medicine. The patient is aware of the chance that they might get placebo, but in this case, the alternative treatment is not proved to be safe from research and data. Someone else has said, I believe alternative medicine should only be prescribed for colds and common symptoms, and telling them exactly what it is, and that it might relieve symptoms. And someone else said, no, placebos are known not to cause harm, whereas CAMs are unregulated and it's not possible to know their contents. They may have, side effects, which can make it, their prognosis more complicated. So okay, I think that's many people have kind of picked up on the differences between placebos and alternative medicines, mainly the fact that CAMs are unregulated and kind of unlicensed often, and doctors, and therefore they should be kind of kept aside from conventional medicine, and therefore they shouldn't be used in the place of placebos or as an alternative to conventional treatments. Okay, so I think we're going to move on now. So we're going to talk about CBD, Siddhant. Yeah.
Yeah. Okay. So CBD, or cannabidiol. So it comes from cannabis, which is, it's a drug. It's a recreational drug. It's one of the active ingredients in cannabis. However, it does not induce a high. This is called the chemical THC. This is caused by the chemical THC. It is extremely effective at reducing the frequency of seizures caused by certain epilepsy syndromes, including Dravet syndrome and LGS, and in some cases managed to stop seizures altogether. It has some other medical purposes as well, because it can also be used to treat pain, and I think it's going to talk about this as well. It says also can be used to treat anxiety and insomnia, as well as joint pain and arthritis when applied to the skin. Industrially processed and quality controlled CBD is legal in the UK. It can be prescribed as a complementary treatment. So cannabis imports to the UK are heavily restricted. It's a Class B drug. However, this also means that CBD production is also very limited, and the majority of CBD in the UK is unlicensed and deregulated. So just a quick fact about CBD, actually. CBD, cannabidiol, the oil, it can come in a few forms. So it can be topical, it could be I don't know if it can be topical actually, but I know it comes in creams, some sprays, etc. And it's used for a variety of things because of the chemicals inside. It actually affects it causes overall calming effect, and in THC it can cause a high, and that's when you hear people get high off cannabis. But it can actually help with pain. And before we go on to the next slide, there's actually a type of pain called trigeminal neuralgia. I'll write that in the chat quickly if anyone wants to research it. But trigeminal neuralgia. Right, so that is actually a type of pain, and it's such an excruciating pain that there's a disease called suicide disease, where this type of pain occurs. So in your trigeminal nerve, this pain can be caused by just a tiny bit of sensation in the face. So when you're brushing your teeth, or when people wake up in the morning, if they have this disease, it causes serious bouts of really extreme, excruciating pain. And I don't know if any of you know BuzzFeed, but like, I think one of the producers in BuzzFeed in America had this, and it's called suicide disease actually, because quite a high proportion of people that have this disease can't bear the pain, and sadly they commit suicide. And you know, some studies have shown that CBD, cannabis, actually can help with this. But obviously, as you know, cannabis is not legally available everywhere, and it's definitely not something you can easily obtain everywhere. So, you know, that increases the amount of debate over this, because if something can potentially save lives, if there's a disease called suicide disease, and if we can stop people from committing suicide by making something legal, then maybe it's less maleficent than actually people believe it is. And obviously, one of the medical principles of ethics is beneficence, doing everything you do with the patient, for the patient, with the best intent. So, does anyone have any ideas about that? Like, maybe they want to add anything about trigeminal neuralgia, or do you guys have any questions about this? I know someone said class B, like if you can explain the class B. I'll do that now, but does anyone have any other questions, or maybe about cannabidiol or uses?
Can I ask, is CBD an alternative medicine?
I believe, Shivas, you want to take that one?
Yeah, so CBD itself is an ingredient of it, so it's not directly used. It's used to make certain products which can be used as alternative medicines, which can be used to treat epilepsy and stuff like that. But it's not, because of the restriction of cannabis, it makes it quite difficult to produce CBD products, and therefore most of the products we have for these conditions do not include CBD. So therefore, lots of products are produced by third parties. They're not produced by, the NHS or pharmaceutical companies. They're produced, abroad, and therefore they're considered to be alternative medicines due to the fact that they're not prescribed, by the NHS. So yes, I would say so, yeah.
I hope that answers your question. I'm just going to answer the question about what is a Class B drug. How can you explain about the Class B drug thing? Okay, so in the UK, there are 3 classes for drugs that are illegal, and these are classes A, B, and C. And the most serious illegal drugs are class A, and then that decreases as you go down class C. But then all 3 classes are illegal drugs, and they are controlled under the Misuse of Drugs Act of 1971. And it's basically because these drugs can actually cause harm, and the class systems are based on how much harm it can cause. So it's an offense, obviously, to unlawfully possess a controlled drug from class A, B, or C, to possess this with intent to supply it. So, drug dealing, to unlawfully supply it, like selling it, or, just giving it to people, that's illegal. And, you can't, I think the other one is that you can't have, if you own a premises, or if you have jurisdiction over premises, you can't allow people to just come and smoke these drugs in your premises. And this is all of the Misuse of Drugs Act in 1971. This is from that law. So Class A is, so a few examples of it is MDMA, ecstasy, magic, mushrooms, LSD, crystal meth, things like these. These are Class A. These cause the most harm to your body. I think possessions, 6 to 8 years, I believe it's somewhere around there, for 6 to 8 years in prison. And if you supply it, it's even more. I'm pretty sure it can go up to, because obviously it's the most serious, I think it can go up to life. Class B is like amphetamines. You've got obviously cannabidiols, cannabinoids, synthetic cathinones, and cannabis, barbiturates, etc. These carry up to 5 years in prison for possession of this, and then for supply, I think it's up to 14. And I'll check that after this. And then also Class C is anabolic steroids, diazepam, and a host of other diseases. And for possession, it's 2 years in prison, and for supplying, it's 14 years in prison. So obviously, these are all highly illegal drugs that cause ridiculous amounts of harm to your body. But then, as we can see, some of them have slightly good medicinal effects in small amounts. So that's the class system. I hope that answers your question about the class systems. And actually, what I'll do is I'll research that everything I said was correct there after this. I think it was. Here's a website. Actually, I'll send a website later. But if you see class in front of it, if it's class A, B, or C, those are illegal controlled drugs in the UK.
Yeah. And someone has asked about, you know, whether why we don't just import CBD itself rather than marijuana, and that's because the CBD, it has to go basically. If it's just imported in its pure form in as CBD, it's very difficult to know its, you know, origin and its chemical composition and whether other substances have been added and stuff like that. And the main risk is THC, which we did mention, which is one of the more potent chemicals in cannabis. And so, you know, that's the thing we really need to restrict. But yes, CBD is, the NHS does provide CBD as a treatment, but it's just somewhere which is very underfunded, and you know that causes a lot of problems, which we'll talk about in a second. But we're just going to talk about the Billy Caldwell case. Siddhant, do you want to go through this perhaps, and then we'll
Okay, so 15-year-old Billy Caldwell has a rare form of epilepsy which caused him to experience up to 300 life-threatening seizures every day since birth. So let that sink in, guys. 300 life-threatening seizures every single day. And cannabis oil has been shown to be particularly effective at treating his condition. And despite this, NHS medical staff refused to prescribe it to him due to cannabis oil being illegal. After traveling abroad to obtain cannabis in 2018, Billy's cannabis oil was seized at Heathrow Airport, which sparked a media outrage. For 2 years after that, a Canadian pharmaceutical company supplied Billy with cannabis oil-based medication and covered all its costs. However, this agreement ended in June 2020, so very recently, forcing Billy's mother to plead to the Health Secretary, Matt Hancock, to allow her son access to cannabis oil in the UK. In October 2020, Billy and his mother won the case last month, after years of campaigning. NHS vowed to cover the cost of the first round of treatment, making Billy the first UK patient to be given NHS-prescribed cannabis. So that's the Billy Caldwell case. It was in the news recently. It's quite a famous case. It's been going for quite a few years. But this is just one example of showing how cannabis can actually be really helpful. Does anyone recognize, well, actually both things. Can you see any potential problems with this, or allowing one patient to have, Billy to have access to cannabis oil legally? Does anyone have any ideas? I've got a few. I'll tell you guys after. But does anyone have any ideas? So just to get the ball rolling, one of the ideas I thought was that, some people may take advantage of it. Yes, exactly. So just one example of taking advantage of it would be that if lots of legal cases are based on precedents. Precedents means that if it's happened once, it's, lawyers can use it, or judges may do it again based on the fact that it happened once. And like someone said, if one person has access, other people should have access too. So because of this, it's quite possible that there might be a domino effect where more and more people ask for access, even though they may not entirely need it. So it's quite important to control this quite carefully. What will be the line between what disease should be treated with CBD oil and what shouldn't, and who should decide? Again, this is a really good question. The pragmatics and practicality of it is something that we don't know yet, because we haven't done this at such a scale, and the NHS doesn't supply it to a huge amount of people. So we'd have to find out later. And again, that's an ethical issue. And does that mean that there is no effective legal drug to treat epilepsy? That's a good question. I'm not sure about that, actually. Shiraz, do you know?
There are, but I believe CBD is one of the most effective. So that's the one that they're kind of pushing the most at the moment. But yeah, I think, especially in this case, because in the Billy Caldwell case, there were no alternatives that the NHS offered to treat his condition, but CBD or cannabis oil was shown to be very effective. So, which is why he had to obtain it from abroad. But someone has said sodium valproate, I think, is also used. So yeah, there perhaps are others, um, but I think the reason he had to get it from abroad was because, you know, that was the most effective.
Is it alright if I say something
Of course.
quickly? So yeah, there are anti-epileptic drugs available in the NHS, but for certain, because epilepsy is not just one thing. Like there are different forms of epilepsy. Like you said, I think you mentioned Dravet syndrome and Lennox-Gastaut syndrome. I don't know how to pronounce it, but for certain conditions, these anti-epileptic drugs, like you said, aren't very effective, which is why um Billy had to get the cannabis, the CBD oil things. So yeah, I can't remember exactly, but I think they have like some side effects as well, these anti-epileptic drugs, which make it worse for children like Billy. I think it's something to do with like hyperinflammation of his liver or something. I can't really remember, but it was something like that. But yeah.
Yeah, it's true. I think, yeah, that's the main reason. But yeah, I think if we can move on now to talk about kind of taking this information into account. Do you think the UK should ease restrictions on cannabis imports and production, which would allow for the expansion of medical CBD manufacture? So yeah, we'll discuss both sides of this argument. But first, I think we'll talk about why you think restrictions on cannabis should be eased and kind of the benefits of doing that, taking into account, you know, stuff like the Billy Caldwell case with, you know, obviously he had the difficulty that there was in obtaining his treatment, and perhaps how that could be avoided. But also taking into account the risks of uncontrolled, you know, cannabis imports and products produced by cannabis. So yeah, perhaps if you can put your ideas in the chat, or you can say them out loud if you'd like to, but just taking into account all the stuff we've kind of learned.
Well, I think there's a very large possibility that someone else in the UK has the same or very similar case to Billy. So and that person may not have the time or the money to fight for their case like he did. So that's why maybe it should be eased, but also people are going to try and abuse that and try and get more to them to sell, which is going to be a really big issue. But
Yeah, absolutely. I think that's what really the main point, isn't it? Because if we do expand, if we do allow for this expansion, it could really save a lot of lives. Really, it could improve the conditions of many people who have similar cases to Billy. Yeah, someone said, why can't it be eased only for medical access? So I did mention this before, but it's mainly due to the fact that if we just import CBD itself, we don't know its origins and composition, and there's an increased risk of THC being present, and therefore it's very unreliable. So we'd have to import cannabis first, and then to produce these products where they can be tested in the UK more safely, and then produced and then supplied by the NHS. So I think that's the main reason.
Sorry, I meant why can't cannabis imports only be allowed if it's for medical access, and so it'd be highly regulated, and if it was for anything other than medical use, the same restrictions and punishments would apply.
Yeah, well, that's the aim, really. That's what we want. But, you know, if we do increase it, then, you know, there's no knowing really that how much of it wouldn't really go towards medical use. And there's a risk of people taking advantage of it and smuggling or using, importing cannabis, you know, pretending that it's going to be used medically. But then, you know, perhaps that's not the case, really. There's a chance for corruption and stuff like that to occur. And that's the problem here. Whereas if we completely restrict cannabis imports altogether, it reduces that risk.
For that, hello?
Yeah,
Oh,
go ahead.
for that corruption point, can you not use Canada as an example, where they've legalized, if I'm correct, cannabis, and they have managed to regulate it quite well for medicinal purposes, and it's not a completely dystopian future for them with people trying to abuse the system, and it's been quite helpful for them.
Yeah, well, that's why many people are arguing that the UK has a system similar to Canada. But yeah, that's kind of what we're debating here. Should you know? But yeah, so what we want really is the best of both, having a system whereby we can import cannabis, but also ensuring that it's for, you know, medical and safe purposes, really. But yeah, to answer the question, sort of, we've got a few points here. Obviously, the main one is really that it's effective at treating conditions, including epilepsy. But the heavy restrictions mean that there's a huge lack of research into safety and effectiveness of CBD treatments. So if we were to increase imports, then that would allow for more testing here in the UK, and allowing for us to produce more safe products that are acceptable to be, you know, provided here. And you know, the lack of availability also means that people are forced to obtain it from third parties or even other countries, where it's, you know, more unreliable. We don't really know whether it can contain THC as well, which is of course has a much higher risk of problems like, you know, related to cannabis. And people, you know, you could argue that it goes against the pillar of justice for the NHS, you know, providing free, you know, good healthcare to everyone as well. And easing restrictions would reduce illegal smuggling, selling cannabis on the black market as well. So someone said, if tobacco is allowed, regulated cannabis should be allowed too, especially for medicinal purposes. So this is the argument that many people are sort of providing here. They're sort of saying that we should allow it, that, because of the benefits it can provide, similar to tobacco. But it would, I think, also to do with research, can really help us develop our research surrounding CBD so that we can provide safe treatments. It would reduce the need for people to, you know, look for third parties to provide these treatments for them. So yes, I don't know. Can you do the other side, perhaps? You know, why restrictions shouldn't be eased, perhaps?
Yeah. So, does anyone have any ideas, first of all, why cannabis should not be eased? Like the restrictions on cannabis should not be eased, or maybe you know, they should be kept the same, or maybe even made tougher? No, that's fine. Yeah, Shivas.
Yeah, so I'll just put it on here.
Yeah, okay, so the large-scale medical use of CBD is still relatively new, and therefore the long-term side effects of its use are unknown. Yeah, that's true as well, because like we talked about, the first time when we'll introduce it will be quite a new topic, so we won't know exactly how practically it will be handled. So that's a good point. Removing restrictions on cannabis imports can make it easier for people to obtain cannabis without facing legal repercussions. This could lead to more heavy use of cannabis as a recreational drug. Yeah, so like I said, it's obviously quite difficult to see how many people are going to abuse this, and obviously we don't want people to abuse this. We want it to be there for people that really need it. And there was a quote actually where people who don't say anything are in pain, and people who do say stuff like speak out about their pain are in even more pain than imaginable. They're in ridiculous amounts of pain. And so if people are suffering so much, we want this to be available for other people. Someone says slippery slope argument. Would you like to explain why? Can get worse over time. What can get worse on time, sorry? Worse over time? If CBD is legalized. Rise in cocaine or something. Yeah, okay, not bad. So again, the reason CBD legalization is something that people are talking about is because that it's possible that it might have medicinal properties and something that could actually help people, especially with the trigeminal neuralgia. So it's quite possible that people, you know, it's maybe cocaine won't have the same sort of medicinal effects, and maybe that's why it might not be legalized. But yeah, you're right. It's quite possible that that could be an argument that would be brought up. Use of tobacco is allowed, yet there is a causal link between it and lung cancer. It being new and unknown seems quite a weak argument. Yeah, that's true, because that's actually a really good point. I didn't think of that. But yeah, because I guess maybe cannabis is more, I'm not sure about this, but maybe cannabis is more addictive. But again, that's a really good point, and I really don't know how to respond to that. the public's autonomy should be respected. Their access to medicinal cannabis should not be restricted. Yeah, that's also true. Like, we should be respecting autonomy, but again, none of these points are hard and fast. All of them can be argued either side. So it's quite important to take that into account when you're answering questions about this, if this topic comes up. Cool.
Okay, so yeah, right. So yes, someone's just said that Biden has won. By the way, I just got a notification on my phone as well. So yeah, we won't keep this going for too long, so you can look at the election news. But yeah, just to finish up now, I think overall what we've talked about today is that CBDs do have risks, and the fact that they're not integrated into mainstream medicine means that there are risks of people obtaining them illegally, people obtaining stuff that isn't tested thoroughly, especially with regards to cannabis, where there's also a stigma surrounding cannabis use. And many people, simply due to the fact that the chemical CBD is obtained from cannabis, are very reluctant to use it. But I think a potential solution is not necessarily to make the NHS. So if we move on, just as a summary, is it maybe it's not the right thing to allow the NHS not to fund increased complementary and alternative medicine, so that the NHS doesn't necessarily have to provide them for us, but perhaps should increase awareness about which CAMs are effective and which aren't. And just so people are aware of the risks, and therefore we can avoid the risks that we discussed today. So just to finish off, I wonder if anyone has any sort of ideas regarding this. Do you think that we should fund CAMs in the NHS? Is that the solution to this? Because we've seen. Yeah.
I mean, they're not as rigorously tested or tried as the medicine that we use now. So why should they be held to the same standard if they're not put to the same standard in the way medicine is today?
Yeah. So well, the thing is, they aren't tested to the same standard as conventional medicine. But could they, if they were, then could that solve some of the problems that we've experienced? Do you think if we did invest, because at the end of the day, all medicine has roots in plants, really. They're derived from chemicals in plants usually. So perhaps these traditional treatments do have a scientific basis. If we did fund research for them, then we could really advance medical research anyway. So could we solve that the issue of people obtaining it illegally, and solve the issues of unlicensed CAMs? So yeah, that's just something to consider, really. But I wonder if anyone, so someone's put more funding into clinical trials, prevent situations that had come up in the case studies, could prevent many deaths possibly. So yeah, so that's one of the main arguments. If we do fund it for clinical trials, if we do fund CAMs, then perhaps in the first case study we talked about, the doctor would have been able to say, oh yes, we've done trials on this essential oil, it doesn't work, and then the patient may have chosen chemotherapy instead. So that's what we're saying, that if we do invest in it, then it could potentially save many lives. But at the same time, if we are investing into CAMs, we're sacrificing spending in other areas, which people may argue it's worth investing into medicines and treatments that we know are effective, rather than hypothetically effective medicines. So yeah, it's an interesting debate. But I think we've kind of run out of time now, so I think we'll finish up, unless Siddharth, you want to add anything? No? Okay, so yeah, we've had a good discussion. If you have any questions, any follow-up questions, then please do message us on our Instagram at themedicaldebate, or email us as well. But apart from that, I think we're finished. So thank you very much, and please join us next week again.
Yeah. Some people were just messaging us to say when the website will be up. We're really trying to get it out as quickly as possible. We've just encountered some difficulties, but we will be getting there hopefully before Christmas. But we'll let you guys know, okay? Thank you very much for coming, and we'll see you next week.